All right, good morning, everyone. This is Drea Welch. I'm the COVID lead for the Anchorage Emergency Operations Center, and I will be facilitating this external brief today, and we'll get started. All right, so just reminding everyone to get vaccinated. We've got an at-home vaccine program where if you'd like to get vaccinated in the comfort of your home, you can make an appointment by calling that number 907-646-3322, or you can also register online at anchoragecovidvaccine.org. All right, so situation overview. Today is day 547 of the response. Currently, we've had an increase in Anchorage of cases of 1,068 since our last briefing last week. We've had an increase of 3 deaths for a total of 212, and an increase of 23 hospitalizations for a total of 1,011. In Alaska, we've had an increase of 3,056 cases for a total of 88,547, an increase of 6 deaths for a total of 444, and an increase of 104 hospitalizations for a total of 2,055. For logistics, we have on the 213 resource requests, we have filled or otherwise satisfied 1,801, and that's an increase of 1 since our last report, and they're currently working 22 open resource requests. For mass care, in the congregate shelters at the Sullivan, they have 375 clients for 1,125 meals. In the quarantine and isolation location, there's currently 85 clients serving 255 meals. And then site 1, 18 clients for 54 meals. Site 2, 21 clients for 63 meals. Site 3, 187 for 561 meals. Site 4, 85 clients for 255 meals. And Site 5, there's 33 clients currently for 99 meals. All in total, this brings the congregate to 375 clients, the non-congregate to 429 clients, and in all shelters, 804 clients currently. As far as testing goes, Visit Healthcare has collected 7,243 sample collections this past week. And then for vaccines in PrepMod, they've done 53,897 for a total of, in all pods, at 90,856. This is an increase of 512 vaccinations in the last week, with the largest increase being at Diamond Center at 253. And did Weather join us this morning?
Hi. Whoop. Hello. It says no longer muted. Hello?
Yeah, go ahead.
Okay. I wasn't sure if you could hear me. Hi, I'm Virginia Rux. I'm a meteorologist at the Sand Lake Weather Service office. I'd like to share to you today that we have low pressure over the south central area today, and it weakens as it moves inland. Showers will linger through the weekend, and while skies will be generally mostly cloudy to overcast, a few sun breaks are possible as we head into next week. Today will be windy through the Turnagain Arm and the upper hillside, but should decrease tonight through the weekend. That's all I have for you. Feel free to ask any questions.
Thank you. We appreciate that update. All right, testing and vaccine. It looks like your slide didn't populate. Go ahead.
That is odd. I will pull it up on the, we did pass it over. One moment, I'll pull it up here on the. Okay, apologies for that. Good morning, everybody. This is Pat Ryder with Emerging Infectious Diseases Assistant Program Manager. Today with testing, Visit Healthcare observed the following over the last 7 days. a 17% increase in sample collections from community and priority populations. This is comprised of a 16% increase in sample collections at the community testing locations and a 25% increase in sample collections from priority populations. Cases in the community and priority populations are continuing to increase. We are averaging 159 cases per day on average. As of August 30th, our estimated daily growth rate is 2.18%, and cases are predicted to double in just under 32 days. Our 14-day average reproductive rate is 1.112, a reminder that a reproductive rate above 1 indicates the virus is continuing to spread. And our 14-day average case rate is 60.5 for every 100,000 residents. Our current alert level is high, and this indicates that there is widespread community transmission with many undetected cases. The vaccines, Visit Healthcare clinics did have an increase in average daily vaccinations of 15.3% from the previous week. We have a few upcoming pop-up vaccine clinics. Tomorrow, we have the Fairview Rec Center from 11 a.m. to 4 p.m. This Friday and Saturday, we have the Fifth Avenue Mall from 12 to 4 p.m. And on Monday, we have the Coalition of BIPOC Educators for the Back to School Jam at the Northway Mall. This will be from 1 to 4 p.m. Finally, just a reminder, our mobile vaccine clinics can come to you wherever you are, be it a church, business, or other organization. For more information or to schedule, please dial 907-531-5100. This concludes testing of vaccines. Barring any questions, end of report.
Thank you for that. And it looks like it did create a second slide for you. So I'll leave that up for just a quick second. And then these will also be available to everyone. All right, contracts and logistics.
Hi all, this is Scott Carpenter with the Contracts and Logistics section. For Mass Care, we had 32 contract extensions that we submitted to the purchasing office to support contracts through October 31st. We're starting the contract extension process now to extend those contracts from November 1st to the end of the year. And then we're also working on the family sheltering options to support the expected increased needs for family sheltering this winter. For testing and vaccination support, we're supporting the testing vaccination team with options if and when boosters become part of the countermeasures. As you heard last week, the testing contract with Visit Health has been extended through 10/31. And we're starting, again, all those contract extensions for the emerging infectious diseases and the testing and vaccine folks now so that those can be ready to move out November 1st through December 31st. And for logistics, we do have 21 resource requests that are in the ready for order status. We had one new request since the last external operations update. And 7 of these requests are to support personnel into the EOC and AHD as a result of increased operations tempo. Barring any questions, that's the end of the report.
Thank you, Logistics. Finance?
Good morning. This is Audrey Jo Malone reporting for Finance. Currently, our current encumbrances for the response is $22,024,646, with actual spent to date of $75,952,730, for a total of $97,977,376. We are currently seeking cost recovery for expenses by way of federal funding through FEMA. To date, the municipality of Anchorage has received $14,931,723 in reimbursement. And as always, please continue submitting invoices and supporting documentation to EOC invoices at anchorageak.gov. End of report.
Thank you, Finance. Safety.
Good morning, everyone. So if you haven't been vaccinated yet and it's because you had COVID, there were studies out that said, you have the protection, but vaccines are still safe and help protect yourself and others from getting sick again. So still get vaccinated even if you have had COVID before. Also, with the long weekend coming up, if you haven't been vaccinated or somebody in your family hasn't, maybe consider postponing travel for the long weekend. Maybe just stay with close family and friends that have been vaccinated in your social circle. Plan a barbecue outside to get together. Stay out of high-risk places if and when possible. And if you have to be in those high-risk places that are indoors, consider wearing a mask, washing your hands frequently, and keeping your distance from others. If you are sick or anybody in your family is sick, isolate, don't go around other people, and let's just keep staying safe and report.
Thank you, Safety. Public information.
Good morning, everybody. As mentioned earlier, we do have an at-home vaccination program being run by our vaccination team. We are beginning to heavily promote that this week. You can see there that the 2 upcoming dates are September 7th and September 9th. We will be pushing out more information to the public about that so that people can register, but they can go directly to anchoragecovidvaccine.org and see both of those dates and go ahead and get signed up for an appointment. We are also working with operations in visiting vaccination and clinic sites to check for directional signage to help make sites as visible as possible to the public when they are going to get vaccinated or tested. And we are supporting the Anchorage Health Department in all of their messaging, specifically about all the layers of protection from mask to vaccination. And finally, we are just beginning to work with outside partners on an awareness campaign about the availability of monoclonal antibody treatment and how providers can refer their patients to receive that treatment. And if somebody does not have a provider, how they can access that treatment. So look for more information about that. Thank you.
Thank you for that report. And do we have any cooperators that would like to report this morning?
Hi, this is Jocelyn from the hospitalist group. I can report.
Sure, go ahead, Jocelyn.
So just a reminder, the Alaska Hospitalist Group is a private physician practice, and we cover Providence and St. Elias here in Anchorage, both the ICU and the medical patients that are admitted to the hospital, as well as Mat-Su and Soldotna. We are increasingly concerned with the volumes that we're seeing in the hospitals and the limited beds in the ICU. We've brought these concerns up. We're working with our hospital partners on working through some of these issues. Largely, the restrictions are driven by nursing staffing, which is a huge challenge right now. So we are collaborating, coordinating with the state on ways to, get additional staff or trying to support our hospital partners as much as possible. With an 800 positive day the other day, I'm really increasingly concerned we're not getting ahead of these numbers and we're not doing enough upstream to promote and shift the culture around masking and vaccines. And so, one program we're trying to promote and we'll work with both the Muni and the state on is promoting monoclonal antibodies to try to keep patients out of the hospital. Again, just to remind everybody, the hospital numbers are lagging indicators. And so what we're seeing in the hospital is really what was out in the community, 2 to 3 weeks ago. And patients don't leave very quickly when they're in the hospital. They're in the hospital a long time. They're on vents for a long time. They take up resources for a while. So, and we sort of have a bit of a bird's eye view because we do cover Soldotna and Mat-Su. Both also have been very, very full. And, the level of acuity of patients that we're taking care of in both of those hospitals is way higher than we have ever had to do. And so lots of concern, and we would like to see some action being taken by the municipality to support masking more broadly. Thank you.
Thank you, Jocelyn. And Ashley, I see you have your hand up.
Good morning, this is Ashley from ASD. Starting tomorrow on our public dashboard, which posts any classroom or school closures, we will be adding total staff and student populations per school, and then how many positive cases are at each school. Other than that, we have 5 walk-up testing sites available for staff, students, and families. Those will be closed on Labor Day. And then starting today, and then every Thursday from 8 to 4 at Abbott Loop Elementary, we will have Pfizer vaccination clinic. It's open to the public. And then every Tuesday from 8 to 4 at North Star Elementary, we will have a Pfizer only vaccination clinic open to the public. I'll post some of that information in the chat so you guys can have it. That's it for me. Thank you.
Thank you for that update, Ashley. And Casey?
Hi, morning. Yeah, so let me, we're tracking kind of the same along as you guys there at Anchorage. We're between the clinics that are doing testing, we're doing about 1,000 tests a day at several different locations. I'll let Kara touch in on Matsu Regional if she wants to do that. We've got the fair going, and public health nursing is running a pod out there at the fair, and I don't have the number of how many folks are coming in to do those. We're still doing kind of walk-up or pop-up pods. We did the opioid task force yesterday, and then we've got another one coming up in Houston next week as well. So we're doing those as needed. But we're just kind of tracking along, seeing the same thing you guys are seeing there in Anchorage. That's about it. We're getting ready for the election season coming up, so we're trying to stockpile some stuff to make sure that that's safe and people get out and vote as well.
Thank you for that update, Casey. And are there any other cooperators on that would like to give an update? All right. Is Jay Bear on to give an update for vaccinations? Okay, not hearing anything. We'll move on to the hospitals. Is anyone on from A&MC?
Hi, good morning. This is Lori Olson.
Morning.
Hi. Today we have 28 positive inpatients, 11 positive in the ICU. 9 of those are on ventilators. Our immediate needs, we're still looking at staffing capacity, and we have now started to look at morgue capacity and alternate capacity for our morgue. End of report.
Thank you. Is anyone on from Alaska Regional?
Good morning. Can you hear me?
Yes, I can. Thank you.
Excellent. Alaska Regional Hospital currently has 28 positive patients, 6 in the ICU, 4 vents. We are currently holding in the ER 4 patients. Staffing and capacity remains an issue for us as well. And this afternoon, we will likely be opening up our ambulance bay as an alternate care site for our holds at the least.
Okay. Thank you for that update. And Providence?
Good morning. This is Nikki Holmes from PAMC. Today we have 46 COVID positive patients. We have 9 in the ICU, 8 on mechanical ventilation, and 17 COVID recovered. We are also dealing with staffing and capacity challenges, so that's our main focus. And also looking at having leaders help out with some of the unit needs as well when it's appropriate. Thank you.
Thank you for that update. And Matsu Regional?
Good morning, Kara Cahill from Matsu Regional Medical Center. Currently, we have 21 positives. 5 of those are in the ICU with 2 on vents. So we have seen a decrease in that, but we have expanded our overall ICU to our 2nd floor and expanded our COVID unit on our medical unit. So, and then filling the same staff restriction, or not restrictions, but just limitations, just like our fellow Anchorage facilities. End of report.
Thank you for that update, and thank you all for your updates on the hospital statuses. Are there any questions? It looks like Brendan, I know you had questions on when and where is ASD doing the vaccines open to the public? Ashley, is that something that you put in the chat? Yes, it looks like every Thursday 8 to 4 at Abbott Loop Elementary School and every Tuesday. Oh, the message didn't get big enough. At North Star Elementary School. And then we had a question for Casey. Can you speak to the availability of the monoclonal antibodies in the Valley?
Sure. So right now there isn't anybody really that's doing it other than some home health care. There's a private ambulances that's doing it in conjunction with individual physicians. One of the main clinics out here is looking at that capability. So we've had a couple of meetings about that, and so I'm expecting within the next week or so that should open up to be able to do that at a set location. But right now it's pretty minimal, but it's coming.
Thank you for that update. Were there any additional questions? Okay, and we do send these slides out following the external brief. So if you're not on that distribution list and would like to be, please drop your email in the chat and we can make sure you get added. We include those as a PDF as well as information about where the recording is located and the current situation report and the health metrics report. So it's just a nice way to have everything in one email. So again, if you don't currently receive those and you would like to, please drop your email in the chat and I can get you added to that distribution list. Our next operational update briefing will be next Thursday at 10 a.m. on the 9th of September. We appreciate everyone calling in and providing situation updates for today. Thank you all and have a great day.